I discussed two abstracts on biliary tract cancer. One was the TOURMALINE Phase IIIB study, and the other one was the HERIZON-BTC-01. The first one, the TOURMALINE, the Phase IIIB, is a study that is testing the combination of Durvalumab plus different gemcitabine-based regimens in patients with biliary tract cancer not previously treated with the systemic therapy for advanced disease. And the rationale of the TOURMALINE study is the prior TOPAZ-1 trial, that is a Phase III trial, that demonstrated the benefit of adding Durvalumab to the standard of care that was a cisplatin gemcitabine. So now the standard of care is represented by cisplatin gemcitabine and Durvalumab, also pembrolizumab, because there is also another Phase III study. But the Phase IIIB TOURMALINE study has different names and enrolled patients with some characteristics different compared to the characteristics of the patients enrolled in the TOPAZ-1. So first, enrolled patients also with ECOG performance status 2 that typically are excluded from Phase III trials, patients who relapsed less than 6 months after surgery or adjuvant therapy, or also with residual disease after surgery. Again, these patients were excluded from the TOPAZ-1 trial, and also patients with ampulla of Vater cancer. Another important point of the TOURMALINE study is that, and this is the focus of analysis presented at ESMO Asia, is that the trial tested a shorter duration of infusion of Durvalumab. Durvalumab is typically infused in 60 minutes. In the TOURMALINE study, the infusion of Durvalumab was reduced and tested 30-minute infusion with the aim to improve the quality of life of the patients, reduce the time at the hospital, reduce healthcare utilization. And the results presented at ESMO Asia were exactly on this reduction in infusion time, and reducing the time of infusion starting from second cycles from 6 minutes to 30 minutes. The authors didn't observe any increase in infusion reactions or anaphylactic reactions. So they are quite similar, well, pretty similar to what was observed in the TOPAZ-1 trial, and the infusion reactions observed were not related to Durvalumab but related to chemotherapy. So overall, it seems to be safe, reducing time of infusion of Durvalumab. The trial is still ongoing, so we will see more data in the near future. The other trial that I discussed is again in the biliary tract cancer setting, but for patients with a HER2 overexpression or amplification, previously treated with at least one regimen of systemic therapy. And these patients received the Zanidatamab, that is a bispecific antibody against HER2. The trial was, the HERIZON-BTC-01 was already presented, and at ESMO Asia, the authors presented the analysis in Asian patients. And overall, the results in Asian patients, even if there are some differences compared to the worldwide cohort, the overall population, but they are quite similar in terms of safety and efficacy. And this is important because there is an ongoing Phase III trial in first line, the HERIZON-BTC-02, that is testing the combination of the standard of care, cisplatin gemcitabine Durvalumab, plus or minus Zanidatamab in patients with HER2 overexpression or amplification. So these data are reassuring and support even more the ongoing Phase III trial.